Hello, everyone. I'm in a forum where people ask many questions that are related to our health. And I often see people who even post their questions anonymously because they're scared that people would judge them because of the status of their oral health. They take pictures, either only, their teeth. They don't want to show their faces because when you look at the state of their oral health, they're very poor. So they have, like a lot of plaque or maybe a lot of cavities or, the gums are so swollen and they don't really want to show themselves because they don't want to be judged. So I want to talk about oral health as and mental health, how mental health can actually affect the oral health. And why did I mention that particular platform is because many people have seen many stories where people, when they talk about their story, they say, I was going through a hard time. I was going through a time when I was depressed. And because of that, this is the result on my teeth. So definitely mental health can affect oral health. You could be that person, and this is the reason why I want to talk to you today. I especially want to talk to you about this today because this month, the month of May, is the month that has been dedicated to mental health awareness. So it's the mental health awareness month, but also it's also the national or health care month. So they coincide. So I want to talk about those subjects today. How can mental health actually affect your oral health? There are many people going through depression, for example, so they have low mental health. And because of that, they're starting to neglect their teeth. And many times that can be understandable, right? Because when you have low mental health or when your mental health has been affected, all you're thinking about, or you maybe like focus on that issue that you're going through. Say, for example, it was triggered maybe by the loss of a loved one. At that point, you might be so affected in such a level of depression that you're not necessarily waking up early in the morning and go, oh my gosh, I have to go and brush my teeth. You might be just in such a state of depression that you're not even thinking, about brushing your teeth. And over time, it can actually lead to problems such as cavities. It can lead to problems such as gum disease, perhaps you suffer from gingivitis, or even worst case scenario, periodontitis, which is where you're starting to lose the support of the bone under your gum, right? And so that will affect your teeth in a manner that your teeth are going to be more mobile. And also, if in fact, because of the fact that you're not brushing your teeth readily, you're not flossing, you start having an accumulation of plaque. And that is what is actually exacerbating that, gum disease. It can even lead you to have, a bad breath or xerostomia. And so a bad breath or halitosis rather. And, that can be a problem. So your mental health can actually affect your oral health via ways of neglect, for example, right? And so that's one way that can happen. Another way that low mental health can affect your oral health is by stress, right? So you're so stressed out, for instance, that you start bruxing your teeth. So you become affected by bruxism. And what is bruxism? Bruxism is where you're starting to clench your teeth and also grinding your teeth. The danger with that disease is that you're starting to wear down the surfaces of your teeth, right? And so little by little, that bruxism can cause so many issues, such as, for instance, you start having flat or grind your teeth or grind it down, so that can lead to sensitivity at the level of your teeth. It can also lead to cracking. Your teeth start getting cracked, or fractured. And even you can start wearing your TMJ areas, so they can be affected. Your TMJ start getting sore, and so you start, having TMJ or TMD, meaning TMJ diseases, right? And so that can cause you other problems because you could end up being in a constant state of pain, on the articulation between your skull and your mandible or your jaw, right? And so bruxism can be caused by your mental health. Many people are not even aware of the fact that they're actually grinding their teeth. Sometimes you can hear when people are grinding your teeth for their teeth. For example, I have a very close family member. She grinds her teeth on a constant basis, and so you can hear it. But many people, they come to the office, we look at their mouth, we look clinically, we look at the radiograph, and lo and behold, we see that they are bruxers. And when we tell them, sir or ma'am, you are a person who bruxes your teeth or you grind your teeth, they say, I don't grind my teeth. And so they don't even know that it's happening. Sometimes it might be, if they're married, maybe their spouse that would be saying, oh yes, I can hear them, grinding their teeth at night. But many times it happens at night and people are not aware of the fact that they're grinding their teeth. Or even sometimes it's somebody that I know very well and always clenching their teeth, maybe while thinking or just, throughout the day, and they're not even aware of the fact that they're actually clenching their teeth. But we can see it because they always have this bulging at this level, right, of their head. And so those can also be induced by poor mental health or mental illness or anxiety or depression. So that's another way that your oral health can be affected by the fact that your mental health has taken a toll. Another way that your mental health can affect your oral health is by the medications that you're taking. So you're actually aware of the fact that, you're suffering from mental health problems and you're going to see your doctor. Your doctor gives you medication and the medication may induce xerostomia, which is dry mouth. So now when you're suffering from dry mouth, all of a sudden you have low salivary flow. And so because you have less saliva in your mouth, then you can start developing cavities, right? And when that happens, it affects your oral health. So that's another way that can happen. So when you come to your dentist, we can actually prescribe some product that will actually induce either salivary flow or, create like artificial saliva for you. And that's going to help you to kind of like hydrate your mouth more. But when you know that you are suffering from dry mouth, you want to make sure that you drink plenty of water, okay? That way, you're hydrating your mouth, and that is going to kind of like help out, because if you're suffering from mental health issues, you don't necessarily want to stop taking your medications because that's stabilizing you. So then you want to do something on the whole oral side that's going to help you. Mental health can also affect your oral health by this way. Say, for instance, you have eating disorders. You have many people who are suffering maybe from anorexia or bulimia, right? And say, for instance, you are that bulimic person. I know someone who had a child that she ended up catching her child, inducing vomiting. And so when that happens, and it can be caused by maybe like emotional distress, emotional problems. Maybe you went through a heartbreak. And so now, you can either feel like you're not worth anything, or you're too big and you see yourself in a different light, or you think that's the reason why maybe like they didn't want me anymore. So you start, inducing vomiting so that, you can control your weight. And sometimes it could be because of the fact that there are some people who, when they're going through depression They may be the person who are going to confide in comfort food, for example, or like they're going to be eating lots and lots of sweet to feel better about themselves. And so it becomes a cycle. So some people gain weight and some people want to control that by, inducing vomiting. So vomiting is very and highly acidic, right? And so it's going to affect your teeth in that, you're starting to have that, you're exposed to those acid juices that are in your food that you're vomiting or just in the vomit. And so that can lead to more cavities formation, okay? And the fact that you're also not going to seek oral health through the neglect or because you're not thinking about your teeth, that can affect your teeth. But also the type of food that you're eating, as I said, if you are now eating a lot of sweets, lots of ice cream, that influx of sugar is also affecting your teeth. So you're going to develop a lot of cavities. So those are ways that your mental health or poor mental health can actually affect your oral health. So what should you do? It becomes difficult. In those cases, we don't want to judge you. We want you to do something versus doing nothing. I know that, we are telling people you have to brush your teeth twice a day. You have to floss every day. If you're not able to do that, try to at least do it even once a day. It's better than not doing it at all. Another thing you can do is maybe putting a timer for yourself, right? Maybe not a timer, yes, for the amount of the length of time that you're going to brush, but also like an alarm, a reminder, so that okay, it's time for me to go and brush my teeth. That can help you. You can talk to your dentist about the fact that you're going through depression or the fact that you're fearful. Because when you do so, we are able to treat you in a more caring manner, okay? And so the fact that we care about you can also encourage you to actually seek out oral health, okay? You can talk to some friends and you can also talk to your doctor, because if you are someone who needs medications can be prescribed to you. You can talk to a therapist, because by talking about your story, we can find ways for you to be taken care of. And that's also going to help improve in the long run your oral health. Okay, so do talk to your dentist, do talk to your physician. That's only going to help you. Do seek out the help, or the care of your family members or friend that can, kind of like maybe get you out or, put you in a better mood. That's going to help you as well. Okay, so that's pretty much what I wanted to talk to you about today. Do seek out care, because taking care of your smile is also taking care of your body, and your mental health. The way you think, the way you care, the way you act is going to help you in the long run and also help your oral health. Okay. If you are a person who is suffering for mental health problems and you want to be taken care of orally or dentally, give us a call, 972-213-0202. Or you can go to our website and request an appointment at www.healingwingsdental.com. We are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. And our office name is Healing Wings Dental. I'm Dr. Valerie Mukanga. At Healing Wings Dental, we take care of your smile as if it was our own smile. And so taking care of your smile, you deserve it. You deserve for someone to take care of your smile, because you matter, okay? And at Healing Wings Dental, we do see you. So until next time, we wish you the best, and we will send out a prayer for you as well if you are someone who's affected by mental health. That being said, we'll see you next time. Take care. Bye-bye.